Hello, everybody. Thank you for the scientific committee of the 30th International Conference on Diabetes and Nutrition to give me the opportunity to present today my research project assessing the status of carbonated beverages consumption after taxes implementation in Saudi Arabia. The prevalence of obesity and type 2 diabetes in Saudi Arabia has been increased dramatically in the last decades. A recent study was conducted, a large survey, collected data from all regions from KSA, shows that there were 24.7% of Saudi population were obese. Previous report from the WHO reported that the prevalence of overweight in Saudi is around 68.2%. Women were a little bit slightly higher than men, where the obesity were 33.7%, where the women represent 39.5% and men 25.5%. Another study shows the prevalence rate of type 2 diabetes increased from 8.5% in 1992 to 39.5% in 2022 among Saudi population. The prevalence of diabetes would expected to be reduced by 10% in 2022 if the obesity prevalence will be reduced. Dietary intake included high intake of sugar, was associated with increased the prevalence of obesity and chronic diseases such as type 2 diabetes. Data from 2016-2017 shows that around 75% of Saudis consumed carbonated beverages between 2 to 3 times per day to at least 1 can per day, while 25% of the population rarely consumed carbonated beverages. Therefore, the Saudi governments, we have in Saudi here different authorization and government policymakers, including Ministry of Health, Public Health Authority, Saudi Food Drug Authority, taking various actions to address the issue with obesity and diabetes in populations, including implementation regulations, policies related to healthy food strategies. In 2018, a selective taxes was imposed on soft drinks. As you've seen here from the slides, limited countries have implemented taxation of carbonated beverages. Saudi Arabia, one of them, and maybe the first in the Gulf countries. The aim of the current study was to assess the pattern of carbonated beverages or soft drinks consumption and the factors and attitudes pre- and post-taxes implementations among Saudi adults. Two cross-sectional studies were conducted. The first one was between July and September 2016, where was before implemented taxation. And the other one was between October 2022 and March 2023, post-implementing taxation. Involve Saudi adults aged 20 to 60 years old, residents in Saudi Arabia. The exclusion criteria included individuals with diabetes mellitus, poor bone health, like osteoporosis, osteopenia, those following diet to lose weight because the diet will not reflect the consumption of soft drinks. Ethical approval for both studies were obtained from an institutional review board at Princess Noor University. The sample size pre-taxation was 964. Post-taxation were 1,931. Data collection was done using a validated questionnaire distributed via social media platforms such as Twitter, WhatsApp, using snowballing sampling technique. The questionnaire has tested for validation and reliability in 2016. The questionnaire included 4 sections: socio-demographic section, pattern of carbonated beverage consumption, which related to the amount of consumption and the frequency, factors influencing carbonated beverages consumptions, and attitude related to carbonated beverages consumption. both the factors and the attitudes are divided to 5 possible responses using 5-point Likert scale, ranged from strongly disagree, disagree, neither agree or disagree, agree, and strongly agree. The majority of the sample in both 2016 and 2022 were female, and that's very common in most of the surveys that's conducted in Saudi Arabia using snowballing, that the majority were females. Also, the majority of them were younger than 40s, and almost 70% were having at least university degree or higher. This slide shows the consumption of carbonated beverages. As you've seen, daily carbonated beverage consumption was reported between 6 to 8%, where the majority consume at least 1 to 3 cans per week. So let's say on average, like 1 to 3 times per week. The majority of the samples had on average 1 can or less of carbonated beverages each time of consumption. The slide shows the changes in the factors influencing carbonated beverages consumption before and after taxation. This table shows we have 8 factors: are availability, affordability, advertising, habit, eating out and at home, TV watching and using electronic devices, and social and family gathering. The table shows that there is an increased percentage of those who agree for availability, habits, eating at home, TV watching, social gathering, and enjoyable after implementation taxation. There were 6 attitudes has been tested for this study, where healthy, enjoyable, values for money is indispensable at the moment and should allow to children. The changes in the attitude towards carbonated beverages before and after taxation has been summarized to, let's say, 3 points. First, increase the percentage of those who disagree for healthy, value for money, and allowed for children. And increase the percentage of those who strongly agree, decrease in the percentage those agree for eating out and advertisement. In conclusion, the carbonated beverages consumption has not been reduced after implementation. Several factors influencing consumption of carbonated beverages, meals at homes, watching TV, and using electronic devices. Health promotion programs are needed to be implemented by the community of Saudi Arabia, like the universities and also the Saudi governments, including Ministry of Health, Public Health Authority, and Saudi Food and Drug Authority, to reduce those factors influencing the consumption of carbonated beverages. In the end, I would acknowledge the co-author that helped me to conduct this study, Dr. Abeer SALMAN from King Abdulaziz University, Dr. Fatma Al-Muayyad, Dr. Nada Ben Ajiba, Dr. Shahad Abdul Qadir, and Dr. Nahla Bawazir. Thank you.